This is where we left off with Gary. Gary's our imaginary patient. He's 24 years old, could be 34 years old. He started using it at 14, drinking alcohol from his parents' liquor cabinet, smoking cigarettes. You know the story, okay? He has, like now, he's got 60 days clean. And we're going to put him in group, or he's been in group. We're going to put him in the group dynamics, and we're going to have like giving a demonstration of how a group could work, okay? And everybody can see it. Everybody can see this. Okay. All right, Gary, you're going to come to group at 10 o'clock this morning. Okay, so here's our group. Sally, Michael, John, Billy. Billy's a little bit nuts. Okay, he needs a little extra help. Here's Gary. Okay. Here's Jim, Tommy, and here is you, the counselor, who is the facilitator. Okay, so remember I explained about the facilitator? You keep things moving along. Okay? Now, what I told you about Gary was we want to help these people resolve the unresolved feelings or process their unresolved feelings from their past. Okay? So, you're going to run group at 10 o'clock. Now, let's just talk about the seating situation. The door is over here. Okay? So, when you run a group, when I run group, I want to be sitting close to the door. And when it gets into counseling, you know, even where you sit is important. Where you sit is important. Your body language, your posture, it's all important. And it's all important in group too. Your posture, your body language, and you want to be able to see everything because you're an observer, but you want to be close to the door too. So here's the door. Now, the reason you want to be close to the door is because you want to control ingress, egress, people coming and going. But you also want to be able to, if somebody wants to leave group, you want to be in a position to kind of stop them. You're not going to block them, you're not going to tackle them. But sometimes people can't deal with their feelings or because they get emotionally involved. Oh, I can't deal with this, I got to go outside. You know, and they'll try to leave because it's too intense. And you want to be in a position where you can kind of hold on, stop them. And there's several cases of this where this one's wanted to leave because talking about something with his wife, and he said, I can't deal with it, I got it, like that. And I was able to stop him. No, don't go. This is a safe place for you to be. But it was the other members of the group who also asked him not to go. And it was actually a couple of the women in the group that said, don't go, wait. And they're like friends. So they kind of stopped him, and he was able to turn around and go back to his seat. And he was actually able to process these feelings he was going about, all the guilt with his wife, that he had, all the shit that he had done with his wife. So but I was able to just put my arm out and stop and don't go. This is where you talk about this stuff. But the other group member said, don't go. And he was able, so you just want to be able to kind of sit where the door is so people can't get past you, okay? So here's the recommendation I'm going to say to you. This is their group, okay? So when it comes to starting the group, I start the group with a 10-second countdown. 5, 4, 3, 2, 1, and just to wait. And everybody, because they're talking amongst themselves. As you do that, 5, 4, 3, 2, 1, and then they'll be quiet. Okay, so you just sit there for a quiet. Sit there and have them be quiet for a minute. Okay, and so then what I'm going to do is what I'm going to teach you and this from a skills perspective, this is a skill, okay? You're going to go around first, and I'm going to explain to you about going around. It's not always the best way to do it, but I'm going to explain to you, and we're going to do what we're going to call a feelings check, okay? You're going to start the group with a feelings check. And what you want to ask them individually is what they are feeling right here before they came into the group today, right now. Don't ask them what they're feeling now. You want to ask them what were you feeling. Let's do a feelings check. What were you feeling just before coming into group? Like when you were walking down the hall, just before you walked through the door, what were you feeling? What was going on with you? Okay? So that kind of opens the door up to a whole lot of stuff. Okay? We don't want to ask them what's going on with you today, last night, a meeting, whatever was going on. We want to know. A feelings check is to check in with their feelings right now, but really not right now, right here, maybe 2 or 3 minutes ago when they walked into group today. So we're going to ask them for a feelings check. Now, you can go around. That's not always good to do, okay? I'll tell you why. Because people know when it's going to get to them and they have a chance to think about it. And, you know, this one's going to go last, and that may not always be a good way to do it, okay? So what I asked them is, we're going to do a feelings check, and as you do this a couple of times in group, they get used to it, a feelings check, okay? So you're going to have a feelings check. And when we get into explaining what the feelings check is, you can do a feelings check anytime in the group process, okay? So you're going to ask feelings check, and you're going to ask them what they were feeling just before they came into group, and you say, who would like to go first? Rather than we're going to go around the room, say, who would like to go first? Now, you do this for a couple of reasons, because somebody may want to go first. If this person wants to go first, you don't want to make him, if you go around the room, you don't want to make him go last. If he wants to go first, you let him go first. If somebody wants to go first, you let them go first. So who wants to go first? This one will say, I'll go first, okay? You say right away, who wants to go second? Somebody say, I'll go second, like that. And you say, okay, I'm going to give you numbers. Who wants to go third? 1, 2, 3. Who wants to go third? Okay, Tom's going to go third, fourth. And you can see if you can get everybody, but you don't always get everybody, but you got 1, 2, 3. And then when you get 1, 2, 3, you say, okay, who didn't go? But you're going to get everybody to go around and give you a feelings check. Okay? So what that does is it gives people the opportunity to, if they come into group today, that there's something going on with them right away, and you're, quote, looking for smoke, okay? This is a feelings check, and you're looking for smoke because something could be going on with any one of these, or all of them, but anyone, and you don't want to run a group and not deal with an issue that someone is having, that they brought into group today, and it was overlooked because you ran a group about something, another topic that did not address what they were going through. I'll give you an example, one of the pitfalls of what not to run group. But you're going to let them explain to you what's going on with them, and you're looking for smoke. Now, if this one over here is upset about something, you're going to observe that, and you're going to maybe come back to that. Maybe come back to that and say, you know, John or Sue, you know, whatever, I noticed you said that you were blah, 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 and you might want to do something more about that. So if someone says, I'm doing okay, I'll pass, I don't want to say anything right now, right? And they're like upset or crying, that's with the content and process, is what they're saying and what they're feeling congruent. Is it the same? No. Okay, so patients can say one thing and be feeling another, or feeling one thing and saying another. So we're looking to give them an opportunity to break that pattern of not being able to talk about their feelings, but they're kind of doing it kind of together. They're doing it together. This is a feelings check that they're doing together. And when it comes to the feelings check, you can do it any time during the course of a group. All right, so when it comes to feelings checks, you're looking to identify feelings, because most of the work that we are doing is helping our patients resolve unresolved feelings of their past. Now, they may not be able to be aware of that, but when you do this like a feelings check like that, and you're looking for smoke, if someone says a feeling, you want to kind of explore that a little bit more. Now, if it's a negative feeling, definitely. Anger, well, you know what the feelings are, but I mean, anger, guilt, shame, remorse, they're upset, they're crying, they're angry, there's something going on there, okay? Or if they say something like, I got to be honest with the group, okay? Honesty is something that we can talk about. Or I got to admit, or I can't accept, or I can accept, okay? Acceptance is something, well, it's a spiritual principle, but acceptance is something that you want to talk about with them. Or honesty, or truth, or all these what we'll call them spiritual principles. They'll say something that has to do with recovery, and that you want to talk about that a little bit more. So everybody follow me on this. Who would like to give me an example of something that someone could say that would either be a feeling or something that they aspire to, or that like a spiritual principle, or something, that they could talk about that's not concrete. It's not like this marker. It's something that exists, but it exists in the abstract. Okay, it's something that exists, but you can't feel it, you can't touch it. It's a feeling, it's a principle, it's something that they feel spiritually or emotionally or something like that. Who'd like to give me an example of something that someone could say in this group? Just shout it out. I'll wait here.
Feeling a little depressed today.
Okay, someone's feeling a little depressed today. Let's make a little boat today. Okay.
I want to be more true to myself.
What's that?
I want to be more true to myself.
I want to be more true. I want to be more true or honest to myself. I want to be more honest. How can I be honest? I want to be honest with myself. Honest with self, okay. Or true to myself. Okay, that's good. Anybody else?
I'm really angry today.
I'm really angry today, okay. They're angry. Okay.
Having negative thoughts.
I'm having negative thoughts. So what could be a negative thought?
Like cravings.
Okay. Cravings. Okay. Anybody else? Okay, so these are just examples, but I mean, there's hundreds of examples that you can give. Well, let's just talk about these, okay? If the patient is feeling depressed, you know if that patient has had a psych eval, if they're on antidepressant medication, or they have a history of depression, anxiety, bipolar disorder, you know that that's an issue there, okay? So we want to get them, when it comes to mental health issues, we want them to be aware of their mental health issues so they can better manage the symptoms, okay? So when they're feeling depressed, that is something that you would go back to and talk about. And that could be, to ask them to explain that a little bit more. Now remember, probing is asking the patient to give us more information, but we're really asking them to self-explore and explain to us, or for clarification for us, for the group, what are they feeling about their depression. But it helps them with mental health disorders because it helps them better manage their mental health or their depressive or anxiety or bipolar symptoms, okay? Honest with self, okay? Honesty is a spiritual principle. It's something that exists, but we can't touch it, we can't feel it, okay? So we would definitely work with that. And angry, what is the patient angry at? Who are they angry at, for the most part? They're angry at themselves. Okay, so with this negative feelings or cravings, now with the DSM-5, cravings is a strong desire or urge to use that is affecting the individual's thinking and behavior, cognitive behavioral thinking and behavior. So it's one of the diagnostic criteria for a substance use disorder. And it's also a treatment outcome indicator. If someone is experiencing cravings, we want to definitely address that as part of a relapse prevention program, as part of their relapse prevention program for cravings, okay? So any one of these things can be a topic of the group. So, for example, the group was able to identify a topic that you can discuss a little bit more. Especially cravings, anger, honesty with self, or honesty in general, that's something that we can kick that around a little bit more. So when you do this feelings check, if something stands out, you want to be able to identify that a little bit more. But let's just take honesty, for example, okay? So now we put that in the middle of the floor here. Okay? This is a way of identifying a group topic, okay? So the topic of the group right now is honesty, okay? So you as a facilitator would identify that. Okay, well, you know what? Honest with self, or the person who said that, you know what? When you talk about honesty and honest with self, let's make that the topic. And honesty is the topic. And ask them, what does that mean? What does that mean to you? Let's see if we can figure that out and talk about that. Who wants to go first? I'll go first. Okay, well, let's go. Let's go. What does that mean? Now, when it comes to things like, I'll just give you a couple examples. Honesty, hope, faith, courage, integrity, discipline, self-discipline, all these spiritual principles that could come up, or these other feelings that can come up. When you identify one, you want to put that in the middle of the room and let them kick that around. Let them see if they can define that. Now, what I've done in the past is I've had a dictionary in group. Just let me see if I can have my dictionary now. This dictionary has seen some beaten up. This is the dictionary I had in group. Because I had to retire it. I got it stapled together. Oh, look, I have honesty marked out. Honesty. Okay, so what I would do was I always had the dictionary in the group. So I would assign the dictionary to someone in the group who would be in charge of the dictionary tonight. Or I'd grab the dictionary. I had the dictionary nearby. So I would have someone look up honesty. Okay, so we would be able to really identify and look it up and clearly explain exactly what that means. But we're not going to do that now. We're going to let them try to kick it around. Or like now we have the phone, that girl that talks to us. We'll ask her what honesty means. Maybe we will. Okay, so we try to kick it around, and what does that mean? And let them struggle with trying to define what that means. And they'll struggle, and they'll bounce things off. each other. And they'll say, oh, I like what Tom said about honesty. And they'll say, well, don't tell me, tell Tom. Tom, I think Tom was onto something there. You're over here. Don't tell me, tell Tom. He's sitting here. So tell Tom, he's right there. And let them kick that around to try to identify what that means. And how they can practice that. How the person who said that, how can they be more honest with themselves? Let me just look at my dictionary here because I have honesty marked. Can I go right to it? Yeah, honest. Not deceptive or fraudulent. Marked by truthfulness and integrity. Okay, so marked by truthfulness and integrity. Upright, not deceptive or fraudulent. Genuine. Okay, so we just got another couple of topics there. Genuineness. Not deceptive, not be fraudulent. Here's a great topic. There's one there. Great topic. Integrity. Okay? Honest, integrity. These are spiritual principles that, for the most part, our clients don't have any idea of. They don't have any clue of. Okay? So we're going to let them see if they can define honesty and see if they can kick that around and define it. And then we're going to say, you know what? Let's go to the dictionary and find out what it means. And when you explain that to them and give them the definition of honesty, let them talk about the definition of honesty. Okay, so when you're doing this, that could take an hour. It could take an hour to do that. Done a feelings check. We've come up with someone who wants to talk about honesty. We'll put that in the center of the group and kick it around and let them kick the shit out of it. Let them beat it. Let them struggle to find what it means. Okay, so they're struggling to what it means. And then when they've finally exhausted themselves about talking about it, you're going to say, well, who's got the dictionary? Look it up. And remember, I had a kid there with the dictionary. He always had his finger in the, I got it. You ready? Sean, you ready? I got it, Mr. Rule. I'm ready to go. No. We could do that last, let him read that, and then when they say, they'll all go, oh yeah, not deceptive. Truthfulness, genuineness. That's another one. It's good. That's a good for counselors to have a genuineness. Genuineness means to be present, to be there, to be present in whatever's going on in the moment. But it's part of mindfulness. But listen, you've just taken an hour up, maybe more of the group by just going through this. If this is a 3-hour group and you're going to let them take a break after an hour and a half, by the time you do the feelings check, by the time you identify it, let them identify the topic and then put the topic in the middle of the room and let them kick it around and then go to the dictionary and give them the actual definition of it and then let them kick that definition around. They're all going to come to a greater understanding of what that means to be honest with themselves. And they're going to be sitting there saying, wow, yeah, okay. So you're discussing a spiritual principle and how it can affect them and how they can be honest with themselves, because they can't be honest with themselves if they don't know what that means. They can't be honest with their significant others, their wives, their friends, their family, if they don't know what that means. And they may not know what that means. Or they may know what it means, but let them kick it around. Because Jimmy didn't know. This one doesn't, have any idea. This one knows it. This one wants to be more. And you're discussing it. And again, you're not saying a lot. You're not saying a lot. You're just facilitating. You're just saying, who wants to go next? And kick it around. And you're when we get into the TAP 21 and then on, you're keeping the topic on honesty. You're able to intervene when to keep the discussion about the topic and its honesty. And then let them kick that around. Okay? We're going to come back to honesty again as we go through this training, because honesty is a spiritual principle that is part of something else, okay? All right, so look. We said that in the definition of honesty was integrity. And you're going to say, you know what? When we come back from the break, let's talk about integrity. Or when we come back from the break, let's talk about this. Or let them talk about that. And look it up. But integrity, I mean, I know this spiritual principle well because that's come up plenty of times. I've looked it up plenty of times. Integrity means strict personal honesty. So whoever asked us about, Karen, I think, yeah? Karen, you asked us honest with self. So to be honest with yourself, that incorporates integrity. When we look up integrity, I don't have to look it up. I've made integrity the group topic hundreds of times. Integrity means, the definition of integrity is strict personal honesty. That's what integrity means, strict personal honesty. To have integrity, you got to be honest with yourself. You can't have integrity unless you're honest with yourself. But they don't know that. So when we get that topic in the middle of the room here, integrity, and let them define what that means, let them kick that around, and then look it up in the book. That's all good stuff. Where's my eraser? That's all good stuff. So when it comes to starting a group from a skills perspective, you want to start the group with asking them what the feelings check. Doing a feelings check. Who would like to start this one now? When you're going to go around, you're looking for smoke. Now, if you find some smoke, you're going to explore that through probing, get some clarification of what that means. If someone's struggling with something, they're going to get support from the group. You're going to put that in the center of the room, make that the bullseye, okay? And you're going to kick it around and talk about it and define it and see what it means to them, and let them really hash it out. Okay, does everybody follow me on that? And from when you started the group, 5 seconds, you've done that. That could take an hour and a half. If it's a 3-hour group, if it's an hour group, an hour and a half group, that's a group. And they have come up with the topic themselves. They have come up with the topic. And now, here's how you end a group like this. Okay, the group's coming to an end. We're going to have a quick go around again to see if during the course of this group that we have had today, during the course of this group, what feelings did that bring up in you? What feelings, and we're going to say, what feelings, and this is where you have a go around. What feelings does it have with you? And you're going to start and have a go around. Who would like to start and then go around from there? Okay, so they're going to have a chance to say the feelings that were brought up. Yeah, whatever they're going to say. Okay, but this was really good for me because I needed to understand what that meant, honesty or integrity meant, or that I really liked what we did in group today because of this. Or, wow, I'm going to have to think about that more, okay? Or it was a little scary, or it was a little frightening, or I need to be more honest with my... You're going to let them, so we're going to ask them what feelings were brought up for you in group today, okay? And I always end with myself. I include some feelings like I'm part of the group, okay? In closing, you know what? I just, I want to say, I could say, I'm being honest with you guys now. It brought up a lot in me because I could see how well you guys are doing, how honest you are with each other, and I was able to witness that and be part of that, and I got a good feeling out of that, okay? When I have an intern, in the group with me, or an understudy, or someone who's mirroring me, a case actee of that, I include the case actee in it. So if there's an intern there, I always include the intern in the closing feelings check of any feelings that were brought up. Now, the reason you want to do that is so that if the group is over, or everybody's leaving for the day, that no one leaves with any unresolved feelings. So if they felt something in the group You don't want anybody to leave, go out the door, still feeling that feeling. You want them to be able to verbalize that and say it, because it's able to bring closure to the group session. There's closure from starting the feelings check and ending with any feelings that were brought up, so you could do closure, so no one's leaving with any unresolved feelings, and you would identify that in that closing statement from everybody. Okay, that was the hand up. Go ahead.
Yeah, hi, it's Therese. How do you, because I remember being in group and like people would monopolize the time.
Yeah.
Like, how do you transition people into like moving on
Okay.
without dismissing them?
Okay, no. Okay, so that does happen. Then there's a couple of things that do happen, because someone will monopolize the group. And when we talk about that more, if someone's here to monopolize the group, a lot of times 2 or 3 of the other group members will let them do that, okay? Because as long as that person's talking, the focus isn't on me. So they'll kind of let that happen, all right? So when you do the feelings check, a feelings check is just a check. It's just boom, 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 you do 2 or 3 minutes, boom, boom, boom. So they can't monopolize. And then when we pick a topic and we're talking about the topic, who'd like to talk about it, it's easy to keep it moving. You can't and if somebody gets off the topic and starts talking about something else, if it's something else, you could say, you know what, we'll make that the top, we're going to come back and talk about that. What you're talking about, you're talking about this, we're talking about this, you're talking about that. We're going to come back to that. But we're going to keep it on the topic. We're going to keep it moving, okay? And you're going to make a mental note. Whenever you say we're going to come back and talk about that, you must come back and talk about that. And that's just not in group. That's in your real life. If you say this, even your significant other, your wife or something, or kids, you know what? We'll talk about that after dinner, or something like that. When you say that, you got to do that. You got to talk about it after dinner. So if you're going to say we're going to come back to that, we're going to move on right now because I see that someone wants to speak. You're going to keep it moving all the time. That's what a facilitator does. You're not going to let anybody dominate the group. But when we do it this way, it's always moving. It's always moving. Okay, but good question. You're not going to let people do that. You're not, just moving along. And then that person is going to have a chance to do the closing statement. Because we're not going to leave anything. Nobody's going to leave group without saying what they want to say. Okay? All right, so you see how this works? Do you see how this works? Okay, so we're going to get into this more in pitfalls, but this is what you don't want to do. And the counselors, the case activities that I've had who have been afraid about starting a group, they've always wanted to have a topic ready going in. Okay? That's not a good idea to do. Okay? They always want to have some type of topic going in. Not a good idea. Okay? Because when we do this feelings check and we're looking for smoke, if you go in with a topic, that smoke is not going to be addressed. If someone's going through something and you go in with a topic and start out with a topic, that person is going to go sit through the whole group and got something going on with them that they felt here, and it's never going to be addressed. Okay, so you don't want to go in like this. Let me just get some paper off the desk here. Okay, we're going to have group now, and take a seat. Okay, today's group is, what color would you be if you were a car? Okay, I'm going to hand out these worksheets, and we're going to fill out a worksheet. Now, if you were a car, what color would you be? And what car would you be? Would you be a fast car? Would you be a slow car? And I'm going to pass out these worksheets, and we're going to all take a, or today's topic, they're going to come in with a topic. Today's topic is, I want to be a better this. I want to be a better that. And the counselor kind of steers the whole group on a topic that they've come in with from some worksheets that they've got from some book of topics that they've got off the internet, or they're going to come in with a book. Today we're going to read something, or read a poem, or read a daily reading, and that's going to be the topic. Bad idea. Bad. From a skills perspective, bad idea. Okay? The skill is it's their group. You're going to let them pick the topic. You're going to let a topic evolve that you can put into the center of the room and talk about. You're not going to come in with a load of stuff or with a preconceived topic in your mind that they need to talk about. They need to know this. If they're going to be in recovery, they need to know this information, and you're going to bring them that information, and they're going to discuss it, and they're going to get that information, because the people that have something going on with them are going to shut down. People that's got something going on, if that's not addressed, they're going to close up. And you're going to be reading, you're going to be observing all of this stuff. You don't want to do it. It's a bad idea to do that. Okay? Does everybody follow that? Okay, so that is how we do a feelings check to select a topic, put it in the center of the room, let them talk about it, have a dictionary, define the topic, define it clearly, let them talk about that, and then great group today. Does anybody else have anything to add to it? Okay, let's just go around and have a feeling. Let's talk about what feelings came up for you today in group, and they're going to discuss what feelings came up to them in group, and you're not going to let anybody leave without being able to do some closure on what came up in group today. Okay? All right? That's going to be just how you start a group. This is one way to start and get a group going, and let them pick the topic. Okay? So we got a hand up there. Go ahead, Lisa.
How do you know how to keep it like in the right time constraints? Like, how would you know when to start doing that? Like, is it 15 minutes before the group should end? 10, how much time do you give yourself for these things?
Okay, so depending on the size of the group, how many got? 1, 2, 3, 4, 5, 6, 7. You need 2 or 3 minutes each. That would be 14 minutes, okay? So again, with the position of the facilitator, where you're sitting in group by the door, when I'm sitting in group right over here on the wall, I got a clock. There's a clock there. And even right here, when I'm doing this now, when I'm looking now, I'm looking, right? But I'm looking at a watch. I'm looking at the clock. Clock's right here, facing me, okay? I always know how much time I got. I always, it looks like I'm looking, I'm looking at you guys, right? Looking at the computer screen. I can see the clock. You can't tell I'm looking at the clock, but I'm looking at the clock too. That's what it says about the positioning. Positioning is important. Even in the office, in my office here now, there's a chair right there, a comfortable chair where somebody could sit and talk. Right behind them is a clock. And in my office, when I'm in the clinic, when I'm doing the counseling, there's a clock there on the wall. There's 2 or 3 clocks in the room, but there's a clock on the wall, so I'm always looking at the clock. So that would take 2 or 3 minutes. Listen, if you're in an IOP group, you got 3 hours. You got 3 hours in group, okay? And so you always want to be looking at that clock, but when it comes time to, like, first, that last 15, 20 minutes, you want to kind of be, okay, you know what? Let's have a quick go around before the end of group, and just give a feeling of how, so you've set it up. Let's have a quick go around before the end of group. Or if you're in individual counseling setting, okay, let's just summarize what we discussed today in the counseling session before we end, okay? And then you're taking notes. Okay, we talked about this, we talked about that. Oh, we talked about this. You know what? Let's put that on your gratitude list. You've got, this. Let's put that. We'll talk. You know what? You said that's important. You know what? Let's talk about that more next counseling session. Or somebody say something. You know what? That's important. I think, you know what? Bring that up in group tomorrow. So let's talk about that in group tomorrow. And then they talk about it here. I had someone, she explained the trauma. I'm not talking about it in group. No way. I'm not talking about this in group. I'm just, saying that's what it was. She wasn't talking about it in group. Okay, we don't have to talk about it in group. And then, 3 weeks later, the trauma. I said, hey, I think we need to talk about this in group. Next day in group, she talked about it in group. She went from, no way, not talking about this in group. 3 weeks later, she's talking about it in group and everybody's helping her. Everybody helped her. I get an emotional thing about it because I know who it is. She posted some things on Facebook about how she broke through a shell into this beautiful person that she is. Okay, is that another hand up? Go ahead, Karen.
Thank you.
Yeah, I like that what you said today because I remember in one class we were asked to come up with different topics that we would discuss in group.
Mm-hmm.
And today it was a completely different approach because now we don't have to walk into a group session with a topic in mind.
No.
You're telling us a completely different approach where the group is coming up with the actual topic. And I think that's such a better approach.
Yes.
Because they're actually deciding what the topic is going to be.
It's their
They're
group.
doing the feelings check.
Yeah.
I think that's just so much better.
Yes.
Because they're deciding it.
Yes. Yeah. Of course. Well, it does seem better, right? Yeah. You don't.
Most definitely. Because by asking them what it is that they're feeling a few minutes before they walk through the door,
Mm-hmm.
you're opening up like a whole new world by asking them to identify their feelings. And by taking that and then, saying for them to basically define what that is by making those few notations on the side of the board,
Mm-hmm.
You're basically opening up the whole group to discuss exactly what that particular thing is.
Mm-hmm.
And then from there, they can just run with it.
Yeah, absolutely. Yeah, they can kick it around because whatever it is, these people have a lot in common. Okay, but whatever it is, they've probably all gone through something like that. They probably all felt that at one time and not been able to identify it. And like they get like a wow moment, like, wow, you feel like that? That's how I feel. I feel like that too. And they may not, yeah, they may not.
So much better than coming in and saying, well, today we're going to talk about this, because maybe they don't want to talk about that. Or
Right.
maybe that's not what's on their mind at that particular time.
Right.
Maybe they want to talk about something else
Mm-hmm.
that's weighing more heavily. So I think that that's a much better approach.
Yeah, you're exactly right. What happens when you come in with, you have a topic that you, like you explained, you have a topic that you want to talk about, and if they don't want to talk about it, so as you are coming in with this topic that they don't want to talk about, you're going to lose this one and this one, okay? Because they're going to clam up, because they don't want to talk about that. They're going to clam up, and you're going to lose them. Just let me have a look at drink of my water here. Okay? You're going to lose two people, and I'm going to explain this more in another example that I'm going to give you where that's not a good idea. But you're going to lose two people because they don't want to talk about that topic, or they can't relate to that topic, or they think you're an idiot, or they don't like you, or something. And then that person who's kind of clamming up is going to bring another one or two people with them. They're going to bring this person next to them because they're going to pick up on that these people. So you're going to lose 30% of the group, maybe even 50% of the group. I'm going to give you another examples where you're going to lose these people in the group, and they're not going to take part in the group, and they're not going to get as much as they can out of it. So that's well, you can all see that. And everybody who watches the recording can see that that's not a good idea. You lose people that way. And if somebody's got something going on, they're going to come, they're going to leave group, and what they wanted to talk about was never addressed. And they say, you know what, this is stupid. I'm not going to come to group anymore. You're going to lose people like that. This is their group. You are the facilitator. You're helping them make healthy changes. Okay? So everybody got that? . Okay. I just want to give you an example of when it's okay to pick a topic, okay? They're going to go around doing the feelings check, right? And remember I said recovery is a process of change. That word change is so important to us as counselors, okay? Recovery is a process of change. Now, as part of one of the core functions is patient education. I'm going to educate these patients what the definition, what Shams's definition of recovery is, and recovery is a process of change. Okay, so we may have discussed that, they may know that, but they're going to know what it means because I've educated them. Recovery is a process of change. They're going to know that, okay? And if they don't know it, I'll say it and I'll explain it to them. And then I will ask them, we're like at the second part of an IOP group. It's an hour and a half. We've discussed honesty and self on whatever one of those topics was. We're coming back from break, and we're coming back, and I'm going to say, you know what? And we discussed recovery is a process of change. I'm going to ask a question. What do you need to do what do you need to change about yourself, about something that you do, some behavior that you have, that you've repeated and doing over and over again and always works out badly for you? Give me an example of something that you need to change about yourself because it's not working for you. That don't work for you. You've tried it before and it always ends up in a disaster where you relapse, you use something happens, what do you need to change so you can have a better outcome? That's the question. What do you need to change about yourself, something that you're doing that hasn't worked for you? Now, when I ask that in group, and I volunteer on Wednesdays at the Crisis Center, that's one of the topics I explain to them what recovery is a process of change. What do you want to change about yourself? Who'd like to go first? Boom, their hands go up right away. And they know what they've done that hasn't worked. And I've just give them numbers. One, who's going to go second? Who's going to, and I'll let them explain to the group something about they got to do that they have to change, about the same mistakes they make over and over again, going to this, doing that, doing this, lying, robbing, stealing, cheating. That's behavior that they do that always works out in a disaster for them. And let them rat themselves out. Let them tell on themselves. And then this one says, you know, I do that too. And you know what? It's a dumb idea. It's never worked for me. Whether I'm lying to my wife, stealing from this one, not showing up to work on time, being dishonest with everybody, blah, 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 blah. They come up with so many things that they need to, you know what? I need to change that. That's how they finish. You know what? That's not working for me. I need to change that. And then, how are you going to change that? This is a way to develop a topic. So when they ask you, if they ask you what's the topic's always recovery. In groups, the topic is always recovery. If they ask you what's the topic, like I say, what is recovery? What does it mean to you? What is recovery as a process of change? But we come in, or sometimes you come in and they'll say, if a group member says to you, what's the topic today? You know what you say? Well, what do you want to be the topic? What do you think the topic should be today? You let them pick the topic. You don't come into the group and pick the topic. And I can see that makes sense to you guys watching. Okay? That's an example of how to pick a topic. The topic is always recovery. Recovery is a process of change. What do you need to change about yourself? Okay? Does everybody understand? This is the first part of this training on group therapy, a skills perspective. What I've just showed you here now, This is a skill that you will develop and use, and it will work good for you, and it will work good for the patients, the clients. And that's what I want to impart, okay? And I don't think you're going to see that in any one of the books or the literature or anything like that. These are just skills that you're going to use and get better at. Okay? Okay.
Great class today, Professor. Absolutely.